ATV. The World AIDS Conference was held in Melbourne earlier this year. ATV went along to learn about HIV/AIDS.
My name is Colin Dixon. I've been an HIV/AIDS activist and prevention worker since the late 80s in the UK. I'm currently working in the Netherlands in Amsterdam at the Royal Tropical Institute, where I'm coordinating ShareNet International, which is the Dutch government's knowledge platform on sexual reproductive health and rights and HIV. I can remember as a young gay man in the early 80s, first hearing stories coming out of the US about this strange disease which was affecting gay men, primarily then in the big urban centers like San Francisco and New York. That felt a very long way away, but it wasn't long until that same story was hitting Europe, so the UK where I was living. And by the late 80s, many of us in the gay community were experiencing deaths at a rate we'd never expected at such a young age. I can remember in the early 90s, there being weeks where I could be attending 2, 3, 4 funerals of people who died because of AIDS, friends, colleagues, and other acquaintances. We've obviously come a long, long way since then, and I think if you look back to key moments in that epidemic, the first one is that the community is so important, and the gay community came together to really provide the first response to HIV. So we did that ourselves in terms of developing campaigns, helplines, support networks, advocacy to make sure that people were getting the care and treatment they needed. Because stigma was such a huge issue then, and it still is now, unfortunately, and that's one of the things that we're still combating as we move forward in 2014. One of the main reasons we're in a much better place is because of the medical treatments. So from 1997 onwards, we did have a range of antiretroviral therapies, which meant that those people who were lucky enough to get them could actually live healthily with HIV, and that means a whole different type of epidemic. Now, in 2014, we've got even more tools. So already at this conference, we've talked about PrEP, so treatment that particularly gay men can take before to prevent themselves becoming infected. In some countries, public health messages promote circumcision as another tool in terms of preventing. Treatment and prevention is probably one of the biggest things. So gay men who are effectively on treatments, anybody who's effectively on treatments, now has been proven that it's very unlikely that they'll pass the virus on. The biggest problem we face now in 2014 is, I think, discrimination and stigma. So those groups of people who are now the ones mostly dying with AIDS are people from the most vulnerable communities in our society, and that's gay men and other men who have sex with men. It's sex workers, it's people who inject drugs, people who are in prison, and then in Africa and other developing countries, girls and young women. And one of the key messages I've got from the conference today in terms of looking ahead is that we can end AIDS now. We've got those tools. We can actually do that. It's within our grasp, and that's the most exciting message from the conference I've had so far. But if we're going to do that, we need to really work to support those vulnerable communities. In over 81 countries, there's laws which make homosexual behavior illegal. How can you do effective health campaigns targeting gay men if you can't even talk about it? Again, in many, many countries, there's nothing available for people injecting drugs in terms of needle exchanges, places to get information. So if we really want to reach our goal of ending AIDS by 2030, then our first step has to be to start to work with those vulnerable communities, engage with them, and make sure that we can provide the services, the support, the care, treatment access that they need.
We are here on this 20th anniversary of the conference to celebrate so much of the progress that has been made, because the world made the right decision to fight AIDS
I'm Janelle Fawkes, the Chief Executive Officer of Scarlet Alliance, the Australian Sex Workers Association. We're here at the 20th International AIDS Conference, along with our regional network, the Asia Pacific Network of Sex Workers, and our global network, the Network of Sex Work Projects. And we have sex workers from more than 30 countries from around the world. We had a 2-day pre-conference with sex workers, more than 100 sex workers coming together, developing a consensus statement across 5 key areas. So we've brought those key messages into the conference, firstly through our satellite session on Sunday, but also through every other opportunity we've had at advocacy throughout the conference. 2 of the key messages are that sex workers globally are campaigning for decriminalisation of sex work. That's because we know that's the best model for supporting HIV prevention work, so that HIV peer education services can access sex workers. But also it's the kind of model that supports sex workers to be able to implement safe sex practices with our clients. So obviously for HIV prevention, that's an important aspect. But also important to us is decriminalisation removes the police as the regulators of the industry. So that kind of police corruption, harassment, misuse of powers that happens whenever police are the regulators of the industry is removed under decriminalisation. As sex workers, we're going to continue to push our message and make sure everyone hears it loud and clearly. I think we've done that really well at this conference. We've had headlines up in the inner city of Melbourne saying decriminalisation would prevent HIV, sex workers say. However, that leadership that needs to come from a government and a donor level, donors need to support our work on advocacy and our work on human rights, and some of them are moving in that direction, but many others have to follow suit. So it's that space where we need to have more support and do more in the future, but also see governments come to the party. In Australia, we talk a lot about partnership and the partnership between key affected populations and government. But I guess what we're seeing is a level of apathy and a level of lack of action on key human rights, legal and policy issues. I sit on a number of committees in Australia representing sex workers, and we all know the rhetoric, we all know what needs to happen, but we've got to take those steps, and we've got to do it now, because there's sex workers in our region who are dying purely because there's a lack of action in this space.